Joining us now with an in-depth look at this report is Andrew Longhurst, author of the report and a political economist at Simon Fraser University, also research associate with the Canadian Centre for Policy Alternatives. Andrew, it's good to have you on. Thanks so much for joining us.
Thanks for having me.
Was any of this shocking to you, first of all?
It was. The degree to which for-profit staffing agencies have taken off in the province of Ontario, and in the relative growth, too, that we're seeing when, as you mentioned, we're seeing only a 6% real per capita increase on hospital-employed staff. And this comes as we've seen a doubling of public expenditure on private agency staffing.
I'm not sure most people know why hospitals and care homes turn to staffing agencies. Can you explain that? And can you give us a sense of what's going on according to your data? And it should be noted that these staffing agencies obviously cost a lot more.
They do. So a lot of hospitals and other healthcare providers turn to private staffing agencies to fill vacancies, in many cases in a lot of Ontario hospitals, especially in Northern Ontario, to simply keep emergency departments open. So we know it's far from ideal, but it's often what's used to keep hospitals and health services operating. But the problem is it doesn't solve the problem of vacancies and staffing shortages. What we've seen over the last decade in the province is a system where the provincial government has underfunded public hospitals, and that means they're not allowed to negotiate wages and compensation that is attractive, that is enabling hospitals to recruit and retain that more cost-effective public sector workforce. And so they're forced to then turn to a hugely costly for-profit staffing model that's really squeezing hospital budgets across the province, leaving them in deficits.
Andrew, the report notes that using private agencies often becomes a vicious cycle. Tell me why.
Well, folks that accept private agency work are simply not available to accept permanent employment in public hospitals. So we know that workforce is no longer available. And when you're trying to recruit and retain to address shortages, we know that over the last decade, vacancies in hospitals has increased 331%. And then on top of it, the provincial government brought wage suppression legislation in the public sector. This was Bill 124. They brought that in 2019. It was found to be unconstitutional. It was repealed. But the lasting damage here is that it's very difficult to recruit and retain within a system where wages have not really respected the valuable work of permanent public sector staff. And so one of the pieces here is the more that governments entrench this model, that public sector workforce is simply not going to be there because folks are working for private for-profit agencies.
The report does recommend phasing out staffing agencies over a couple years and then ultimately banning them. I want to ask you if you think that's realistic, given what's going on in our healthcare system, given that hospitals are having such a hard time filling shifts.
Yeah, what we need to see is a phased plan by the government, like we saw in Quebec, which by next year in that province will have legislated for-profit staffing agencies out of use in publicly funded healthcare. And so similarly, Ontario can follow the lead of Quebec and also look to a province west of Ontario, that's BC, which is looking to introduce a public sector alternative. Because we know that some rural and remote hospitals especially, there's going to always be a need for some form of temporary staffing support, but doing that within the public sector a more cost-effective way, it's a more prudent use of public tax dollars, and it means that we free up dollars to then increase staffing levels across the board, and that's what we really need to see right now.
Andrew Longhurst, author of the report and research associate with the Canadian Centre for Policy Alternatives. Thanks so much for joining us. Appreciate your time.
Thank you so much.